Have you been feeling tired all the time, even after sleeping? Have you lost interest in the things that used to bring you joy? Do you feel like you're walking through life with a weight on your chest, but no one sees it? Depression doesn't always look like sadness. Sometimes it looks like numbness, irritability, withdrawal, exhaustion. In this video, we're going to talk about what depression really is and what you can do about it. I'm Dr. Georgia Brunner. I'm a psychiatrist and psychotherapist and founder of Beyond Psychiatry. In my work with patients, I've seen how misunderstood depression still is. It's not just about being sad, it's about being stuck. It's about feeling like you're disappearing inside your own life. Today, we're going to walk through the symptoms of depression, the medical and psychological causes, how to tell the difference between depression and burnout, what other mental health conditions can include depressive symptoms, organic causes that can mimic depression, the psychoanalytic perspective, effective therapy options, and finally, powerful first steps that can help you start to feel like yourself again. Let's begin. What are the signs of depression? According to the diagnosis, a depressive episode is characterized by the following core symptoms: depressed mood almost all day, nearly every day, loss of interest and pleasure, anhedonia, reduced energy and fatigue. Additional symptoms: reduced concentration, low self-esteem or low self-confidence, guilt or feeling of worthlessness, negative thoughts about the future, sleep disturbances, too little or too much sleep, changes in appetite or weight, suicidal thoughts or ideation. To diagnose depression, for example, a mild depression, at least 2 core symptoms and 2 additional symptoms. For moderate depression, 2 core symptoms or 3 to 4 additional symptoms. To severe depression, 3 core symptoms, 4 or more additional symptoms. But symptoms don't always present the same. For example, in men, depression often appears as irritability or anger. In adolescents, it might look like defiance or risky behavior. In high-functioning individuals, it hides behind overachievement. What causes depression? Genetics, family history of mood disorders, medical conditions, thyroid disorders, diabetes, chronic pain, psychological factors, childhood trauma, loss, neglect, chronic stress, social factors, isolation, unemployment, relational trauma, lack of support. From a neurobiological perspective, depression affects the hypothalamic pituitary adrenal axis. It alters stress hormone regulation, especially cortisol, and chronic stress can shrink the hippocampus and impair emotional memory. Could lifestyle habits become biological risk factors? Yes, lifestyle patterns like eating fast food, not getting sunlight, or skipping vitamins can influence your mental health on a biochemical level. Scientists call this nutritional psychiatry. How habitual lifestyle impacts the brain. Fast food and refined diets are low in essential nutrients. For example, B vitamins or zinc or omega 3, which are crucial for neurotransmitter production. Observational studies show that frequent fast food consumption is associated with a 36% higher risk of depression. Vitamin D deficiency, often due to low sun exposure, increases the risk of depression by 27% in observational studies. It's also implicated in seasonal affective disorder affecting serotonin function and circadian rhythm. Supplementation in deficient individuals can improve mood within weeks. Depression versus burnout. Burnout and depression share symptoms, but they differ in root cause. Burnout is usually related to external demands, like, for example, chronic workplace stress, emotional exhaustion, depersonalization, reduced sense of accomplishment. Depression is deeper and more pervasive, affects all areas of life, not just work. Mood does not improve with rest or vacation. Loss of meaning, motivation, and pleasure. How to tell the difference? You can also ask yourself, would I feel better if I took a break? If yes, it's likely burnout. If not, depression may be present. But you can also test it. Just take a break and see if it gets better. Often the two overlap. Depressive symptoms can also show up in borderline personality disorder, bipolar disorder, PTSD, anxiety disorders, adjustment disorders like having troubles adjusting to some kind of change in your life. How to differentiate it from other causes, organic or medical causes, for example. Before diagnosing depression, rule out physical causes like hypothyroidism or hyperthyroidism, diabetes or low blood sugar or blood sugar dysregulation, vitamin B12 or D deficiency, anemia, chronic infections like Epstein-Barr virus, medication side effects, beta blockers, corticosteroids, postpartum hormonal shifts, neurological conditions, Parkinson, dementia, substance use or withdrawal, alcohol, benzodiazepines. Let's see other perspectives on depression from a psychotherapeutic perspective, like, for example, psychodynamic perspective. This is seeing the depression like a repressed anger turned inward, early experience of loss, abandonment, harsh internalized voices like the superego, critical voices, conflicts between autonomy and attachment. Some psychotherapists describe depression like an ambivalence, the inability to integrate the good and the bad aspects of self and others. In therapy, bringing these unconscious conflicts into awareness can unlock deep healing. Effective treatment for depression includes medication, of course, antidepressants, psychotherapy, very important, CBT, also psychodynamic therapy, interpersonal therapy is also very important, behavioral activation, acceptance and commitment therapy, lifestyle interventions, sleep hygiene, movement, exercise, reducing inflammation by changing the diet, micronutrients, limiting alcohol, improving gut health. Treatment should be personalized. Depression is not one size fits all. Where to start if you're struggling with depression? Here are powerful first steps. Daily movement. Walk at least 10 minutes outside every morning. Motion is medicine for the brain. Create structure during the day. Plan your morning routine, work blocks, meals, and rest. The brain craves predictability. Nutrition support. Check your iron, B12, D3, and magnesium. Omega-3 fatty acids, probiotics, and adaptogens can also help. Say no. Boundary work is very, very important. Notice where you people please. Start by setting one small boundary per week. Pleasure and connection, also a very important topic in a therapy of depression. Schedule something you enjoy every day, even only 5 minutes. Depression isolates, connection heals. If this video helped you in a way or gave you more clarity, subscribe. I share weekly content about emotional healing, medication therapy, and the tools that actually help. You deserve to feel like yourself again, and I'm here to walk with you. Thank you for watching. See you in the next video.